Hi, my name is George Doucette. I'm the Emergency Medical Services Coordinator for the Norwell Fire Department, and today I'd like to give a lecture on the difference between learning outcomes and instructional goals in emergency medical services. Informational goals in the EMS classroom are generalized statements about what the proposed learning is intended to accomplish. These statements offer no information on how the goals will be met or to what measurable standard they will be evaluated, as this is left to learning objectives. They are simply philosophical statements of what the proposed learning is intended to produce. Instructional goals in the EMS classroom are generally for the student to pass their initial certification or to pass the required continuing education to recertify. Learning outcomes are quite different than instructional goals. The learning outcome from EMS education is to create an EMS provider who possesses the ability to critically think utilizing the information provided in the EMS classroom. A student who not only learns the information, but also has the ability to apply the required knowledge in a vast array of situations and environments. A student who can apply, conceptualize, analyze, and synthesize the information from the class goals at the appropriate time and make decisions rather than follow protocols without thought. Next, I'd like to characterize how goals and outcomes help the EMS student with critical thinking and applying their learning in emergencies. Goals of EMS education assist the EMS student with critical thinking when these goals provide enough information for the student to reach the higher levels of learning as outlined in Bloom's taxonomy for the affective, psychomotor, and cognitive domains. In the affective domain, the student should be able to reach the characterization level where they have integrated the attitudes, values, and ideas into a total philosophy. In the cognitive domain, the student should reach the level of synthesis, where information is combined into new and different ideas. In the psychomotor domain, the level of naturalization is desired, where skills are both flawless and effortless, requiring little or no thought to occur. These goals must have objectives, which using performance agreement assure all goals are met and can be quantitatively assessed by the use of an established metric. Last, I would like to offer my approach on how to meet the goals and outcomes through the use of teaching strategies that work well in the EMS classroom. I would start by serving as a role model, mentor, and primary resource for the EMS students. I would stay current on EMS treatments and field operations. I would let my students know that if I did not know an answer to their questions, I would find it and follow up within a reasonable time frame. Next, I would provide a safe learning environment where students could fail and analyze their failures, learning from them. I would communicate course objectives so students understood the objectives and why they are relevant so they may synthesize information presented. I would have a clear and accurate syllabus and lesson plans for them at the start of the course. Questioning of students would be done utilizing Socratic questioning whenever possible, allowing students to arrive at their own conclusions, applying principles on their own. I would strive to build confidence by positively reinforcing right decisions when they are made. Experiential learning utilizing scenario-based cases and lab setting with mock patients would be the core of higher level learning so students could apply their knowledge to patients or scenarios, allowing them to use their own thought process to decide upon differential diagnoses and treatments. Students could then be questioned to why they chose to treat a patient a certain way or did not, qualifying their critical thinking ability. I hope this helps clarify. Thank you for your time.